Sciatica pain is one of the most common and most disabling conditions I see among adults over the age of 60. It starts quietly, perhaps a dull ache in the lower back, a sharp pull down the leg, or a burning sensation that makes simple movements feel nearly impossible. Many seniors assume this is simply part of aging, but it is not. Sciatica is almost always the result of pressure on the sciatic nerve, and with the correct approach, it can be relieved naturally, often within minutes. Today, I want to share one powerful movement that consistently brings immediate relief to my older patients. It requires no equipment, no medication, and no special strength. It works by reducing nerve compression, restoring blood flow, and reactivating the deep muscles that protect the spine. Before I describe the move, it is important to understand why it works so quickly. When the sciatic nerve becomes irritated, usually from tight hip muscles or a shifted lumbar joint, it sends pain signals through the back, hips, and legs. Most people try painkillers, but medication only masks the symptoms. The real solution comes from releasing the pressure trapped around the nerve. And the simplest, safest way to do that is through a controlled, targeted extension movement. This movement, often known as the standing back extension, gently opens the spine, reduces disc pressure, and allows the sciatic nerve to glide freely again. Seniors often report that their pain decreases almost immediately, even when they have been struggling for months. Here is how to perform it safely. Stand with your feet shoulder width apart and place your hands on the back of your hips. Then slowly and gently lean backward, allowing your chest to lift upward while keeping your legs straight. Hold the position for just 3 seconds, then return to standing. Repeat this 10 times, breathing naturally and keeping the movement slow. It may look simple, but this motion can decompress the lower spine, relax tight muscles, and calm the irritated nerve. Many seniors describe a warm releasing sensation along the lower back and outer thigh after just a few repetitions. That sensation is the pressure easing off the nerve. Consistency is what creates lasting results. Doing this movement several times a day strengthens the protective muscles around the spine, improves posture, and prevents flare-ups from returning. It is not about age, it is about giving your body the right stimulus to heal. If sciatica pain has been limiting your mobility, your sleep, or your freedom, know that relief is possible. A single well-executed movement can restore comfort, confidence, and the ability to enjoy daily life again. The key is taking action and giving your body the opportunity to reset itself. Sciatica in seniors is often misunderstood, and many older adults assume that the pain shooting through the lower back, hip, or leg is simply a natural part of getting older. But in reality, sciatica is not caused by age itself. It is caused by nerve compression, which means something in the lower spine is pressing, pinching, or irritating the sciatic nerve. This nerve runs from the lower back all the way down to the feet, and even a small amount of pressure can trigger intense pain, numbness, or weakness. In seniors, this compression often comes from tight hip muscles, stiff joints, or a slight shift in the position of the spinal discs. Years of sitting, reduced activity, or weakened core muscles can make the spine less stable, causing more pressure to build around the nerve. That is why the pain may come suddenly, even if a person has never had back issues before. The good news is that because the root cause is nerve compression, not aging, relief is absolutely possible. When the pressure on the nerve is reduced even slightly, the pain can decrease quickly. Simple. Controlled movements can gently open the lower spine, relax tight tissues, and restore space around the sciatic nerve. This is why many seniors experience dramatic improvement when they learn how to release that compression naturally. With the right approach, the body responds almost immediately, proving that sciatica is not an unavoidable part of aging, but a mechanical problem that can be corrected with a proper technique. Many seniors facing sciatica pain turn to painkillers because they offer quick relief. But what most people don't realize is that medication only quiets the pain signals traveling from the irritated sciatic nerve to the brain. It does nothing to correct the underlying pressure, stiffness, or mechanical imbalance that is actually causing the discomfort. Painkillers simply numb the sensation for a few hours, and as soon as they wear off, the pain resurfaces because the source of irritation is still there, unchanged. Over time, relying too heavily on medication can even cause seniors to move less, which leads to stiffer joints, weaker muscles, and more nerve compression. This creates a cycle where the pain becomes more frequent and the body becomes less capable of supporting itself naturally. Movement works differently. Instead of masking discomfort, it restores blood flow, improves flexibility, and helps the spine return to its natural alignment. Gentle, targeted exercises strengthen the muscles that support the lower back and hips, allowing the sciatic nerve to glide freely rather than remain trapped or pinched. When seniors learn how to move in ways that decompress the spine and release tight tissues, the body begins repairing itself. Even slow, easy movements can reduce inflammation and stabilize areas that have been neglected for years. Over time, these simple actions retrain the body to function the way it was meant to, improving posture, balance, and mobility. Movement reactivates the healing systems that medication can never replace, giving seniors a reliable and natural path toward long-term relief. The standing back extension is effective because it decompresses the spine by gently reversing the posture most people stay in throughout the day. Many seniors spend long hours sitting, bending forward, or leaning over, which gradually compresses the lower back and increases pressure on the sciatic nerve. Over time, the discs in the lumbar spine get squeezed forward, the hip flexors tighten, and the surrounding tissues become stiff. This creates a downward force on the spine that narrows the space the sciatic nerve needs to move comfortably. The standing back extension counters this pressure by encouraging the spine to open up in the opposite direction. When the body leans backward in a controlled, supported way, the front of the spine stretches while the back of the spine gently separates. This creates more room between the vertebrae and allows the discs to shift back toward their natural position. Even a small amount of decompression can dramatically reduce irritation around the nerve. As seniors perform the movement, it also activates the deep spinal muscles responsible for stability. These muscles often weaken with age or lack of movement, and strengthening them helps maintain the decompressed position for longer periods. Blood flow increases, tight muscles release, and the spine begins to realign itself. Many seniors feel lighter, more upright, and more flexible almost immediately after doing this exercise. What makes it so powerful is that it uses the body's own mechanics to relieve pressure naturally, helping the nerve glide smoothly without friction or compression through a movement that is simple, safe, and highly effective for restoring comfort and mobility. The move provides instant relief by reducing pressure on the sciatic nerve because it directly targets the physical root of the pain rather than simply easing the symptoms. Sciatica occurs when the sciatic nerve becomes irritated or compressed, and this pressure can come from tight muscles, stiff joints, or a slight shift in the lower spine. When seniors perform a controlled extension movement, the body responds immediately by creating space in the lumbar region, allowing the nerve to relax. As the spine gently opens and lengthens, the tissues that were pressing on the nerve begin to lift away, giving the nerve more room to glide freely. This sudden reduction in pressure often leads to an immediate decrease in the burning, shooting, or throbbing sensations that travel down the leg. The movement also encourages the surrounding muscles to release tension, which further reduces nerve irritation. Increased circulation follows, bringing oxygen and nutrients into the lower back area, helping the tissues calm down and recover. Many seniors describe a feeling of warmth or lightness spreading through the lower back and hip after just a few repetitions, a sign that the nerve is no longer being squeezed. Because the move retrains the spine to move in a healthier direction, it can also interrupt the pain cycle that keeps sciatica active. The brain receives fewer distress signals from the nerve, and the muscles automatically begin to relax. This creates a rapid and natural form of relief that does not rely on medication, offering seniors a simple method to regain comfort and mobility by restoring the body's natural balance through gentle, purposeful motion. Seniors should perform the technique slowly, safely, and consistently because the goal is not just to relieve pain, but to retrain the body in a way that protects the spine over the long term. When the movement is rushed or forced, the muscles around the lower back can tighten instead of releasing, which reduces the benefit and can even increase irritation around the sciatic nerve. Slow movement allows the spine to open gradually, giving the discs, joints, and soft tissues enough time to adjust and respond. This gentle approach also helps seniors stay aware of their balance and posture, preventing unnecessary strain. Safety is essential, especially for individuals who may already have stiffness, reduced mobility, or past injuries. Placing hands firmly on the hips for support and moving only within a comfortable range ensures the technique remains helpful rather than risky. Consistency is what turns temporary relief into long-term improvement. Doing the technique only once provides a moment of comfort, but repeating it throughout the day creates lasting changes in the muscles and joints. Each repetition improves circulation, relaxes tight tissues, and reinforces healthy movement patterns. Over time, the spine becomes more flexible, the core muscles become more supportive, and the nerve becomes less likely to become compressed again. Consistency also helps break the cycle of pain and guarding that often develops with chronic sciatica. By moving regularly, seniors teach their bodies that motion is safe and healing, not threatening. This steady, mindful practice builds confidence and restores mobility while reducing the risk of flare-ups. Regular practice prevents future flare-ups and improves long-term mobility because the body adapts to whatever it does repeatedly. And gentle spinal extension teaches the lower back to remain open, flexible, and better supported. When seniors work this movement into their daily routine, the tissues around the sciatic nerve stay looser and less reactive, reducing the chances that tight muscles or stiff joints will compress the nerve again. Each repetition encourages healthier alignment, helping the lumbar spine settle into a position that places less stress on the discs and nerves. Over time, this reduces inflammation and stops the cycle of irritation that leads to recurring pain. Regular practice also strengthens the small stabilizing muscles that often weaken with age or inactivity. When these muscles become stronger, they support the spine more effectively, making sudden twists, long periods of sitting, or everyday bending less likely to trigger a flare-up. Mobility improves because consistent movement increases circulation, delivering nutrients that keep the joints hydrated and the muscles responsive. Seniors begin to notice they can walk longer, stand straighter, and move with more confidence. What starts as a simple exercise becomes a powerful tool for maintaining independence. Small changes build up quietly, and as the body learns to move correctly, flexibility returns and stiffness fades. Regular practice transforms the spine from a vulnerable area into a stronger, more resilient structure. This creates long-lasting comfort, reduces the frequency of painful episodes, and allows seniors to enjoy daily activities without the fear of sudden sciatic pain. Relief from sciatica is not about age. It is about giving your body the right tools to heal itself. What you've learned today is more than just a simple movement. It is a way to restore the comfort, strength, and mobility that many seniors assume is lost forever. When you practice this technique slowly, safely, and consistently, you are not only easing today's pain, you are preventing tomorrow's flare-ups. Every repetition sends a message to your spine that it can relax, decompress, and move the way it was designed to. As the pressure lifts off the sciatic nerve, you begin to walk with more freedom, sleep with more comfort, and live with more confidence. This is your reminder that healing doesn't always come from a pill or a procedure. Sometimes it comes from a simple action performed with intention, and the more regularly you use this move, the more your body begins to change from the inside out. Mobility returns, stiffness fades, and that constant fear of sudden pain starts to disappear. You deserve a life where movement feels natural again, where each day begins with energy instead of discomfort. Stay consistent, trust the process, and give your body the chance to work with you. Your spine can recover, your nerve can calm, and your strength can return. Take this one small step each day and let it become the foundation for a healthier, more comfortable, and more independent future.